Hello everyone, welcome. I'm so glad you're here with me today. Whether you're a dietitian, a caregiver, or someone personally who experiences difficulty in swallowing, this session is for you. Swallowing is sometimes most of us do every day without even thinking, 600 to 1000 times a day. But when swallowing becomes difficult, even every sip of water or every bite of food can become a fear, discomfort, and even a risk thing. Today, we are going to understand what actually happens inside our body when swallowing and why the problems occur, how a diet positioning, smart strategies can make swallowing safer and more comfortable. Let's break down into 4 simple phases. The phase 1, that is the oro pre-preparatory phase. Now, getting ready. Basically this is a getting ready phase, and this phase is where the food enters the mouth and the body prepares it for swallowing. So here what's happened. Your lips closes, the food is inside, your teeth and your jaw start moving, you start chewing, the tongue mixes the food with the saliva, everything becomes together in a soft ball. We call this ball bolus. In this phase, if you find it difficult, you may notice that the food or liquid starts leaking out in front of the mouth. So it is a long chewing time. It feels like as if the food is not forming properly. So if you can try this, imagine a dry cracker or a biscuit. Okay, you place it in your mouth and notice the chewing, the rolling of the tongue, the movement, the saliva, and you imagine if there was no saliva, or if the tongue muscles were weak, or if you're losing, maybe you don't have some teeth and suddenly you can't swallow, you can't chew. Okay, so here the first thing that we do when we find such patients as a dietitian is we change the texture of the food. So we give a food that is softer in consistency, mashed texture, moistened food. Instead of giving dry foods, you add a sauce or a gravy, or I also advise sometimes you can add a broth, so that there's a good mouth feel to it, and you can improve the taste and you can eat in a better this thing. The second phase is the oro transit phase. That is the second phase. What we said is the oro transit phase, that is sending it back. Okay, so when you send it back, so once the food is ready as a ball, as a bolus, the tongue pushes it towards the back of the mouth. Yeah, if you try to have a slow motion of how you are eating. So when you eat, the bolus is in your mouth, and now try to push it at the back. And if this is the phase that is weak, you will notice that the food stays in the mouth for a longer time. Okay, and swallowing becomes very, very difficult. Okay, so you press your tongue on the roof of your mouth and gently pushing it back. This extra movement used to push the food towards the throat. Some of the helpful strategies would be is that you have to understand whether there is enough of strength. Now you can do this with the help of a speech language pathologist, that is the SLP. They may also the dietitian may also advise you thickened liquids if the swallowing reflexes are delayed. Eat slowly and take smaller bites. So we finished the 2 phases. Now in the third phase, what we call as the pharyngeal phase, where there is automatic food, it's called the automatic safety phase. Okay, and this is a protective phase and stage where the body does several things in less than a second. You not even know what's happening. So it is basically a swallow reflex which is triggered, the airway closes, the voice box lifts. Okay, you can't talk and eat at the same time. Our parents used to always tell us, do not talk and eat at the same time. So the food is quickly pushed through the throat, and in this phase you may notice that coughing or choking of the meals a wet or a gurgly voice, so no cough at all is also called a silent aspiration. So it's not necessary that everybody will cough. Many patients do cough, but sometimes there are patients who do not cough. So this is also there, where there could be a silent aspiration. And if you place your finger gently on your throat and now swallow, feel the quick upward movement. That is your airway protecting itself. Do this and you will know what it means. Okay, so what I tell the patient is, first of all, they have to sit upright, chin slightly tucked, eat slowly, small bites, avoid talking whilst eating. So follow safe swallowing techniques. Okay, sometimes your SLP or your dietitian may also help you in this. In a very severe case, the dietitian may say that we may need to even put a tube if it is really unsafe for the patient. So this was phase 3. The phase 4, which is the oropharyngeal phase. Now we also call this as a food tube phase, where once the food enters into the esophagus, a wave of movement pushes it towards your stomach. You can't feel it because it is so quick and so fast that as soon as you swallow the food, it just moves down through the esophagus. And when this phase affects the people, these are the people who will say, atka hai, food is stuck in my chest. They will give you this when you're taking your food recalls, or when you're asking the patient the history as to how they are eating, whether they're able to eat well or no. So they will tell you, no, my food gets stuck in my chest. Okay, or they will tell you, I eat it but then I have to remove it out. So there is like a regurgitation or a reflux, or some will say, oh, I just cough it out and my food comes out. So these are there are some very common aspects which affect these things, like a reflux disease. There could be a stricture. Sometimes because of age there is a motility issue, right? Now very easy tips would be that first of all, after you have eaten food, avoid lying down. So that the reflexes of the reflux is limited. Now where the sometimes you may need to work with a gastroenterologist, because if these symptoms persist, you need to get a thorough checkup and see why you are finding these difficulties. Because actually it's just like a relay race. You do one phase, it goes to the next phase, and it's finished. So each phase is like a handover of the food to the next phase. And you have a control till the food is in your mouth and till the bolus is formed, but after that you have no control over it, right? So even if one phase slows down, or even if one phase out of these 4 phases become weak, the whole process becomes difficult and unsafe. And that is why you need to recognize this as early as possible. The red flags to watch out is, first of all, ask yourself or ask your patient, do I cough or choke during meals? Does the food take a longer time to finish? Do I feel tired halfway through eating? Is there drooling of the food? Does the food stay in my cheek for a very long time? Sometimes you not only observe children doing this, even adults or older people doing this. And it's not that they are fussing to eat. They really have a difficulty. So find out whether there's an actual difficulty in swallowing. Yeah, and if there is, please get it evaluated for swallowing difficulties. If you are a dietitian, remember, you are often the first person to notice that the patient is having a swallowing problem. And the patients, this can really help, because it can prevent pneumonia, it can prevent weight loss, it can prevent unnecessarily visits to the hospital, right? So I will leave you with a question asking you, which phase involves forming the bolus? So if you're able to answer me whether it is a pharyngeal phase, oro-preparatory phase, esophageal phase, you have heard my lecture well. Yes, it is the oro-preparatory phase. And another question, aspiration usually happens because of problems either in the throat, pharyngeal phase or esophageal phase? Where? Yes, that's right. It is the pharyngeal phase. Another question. Food sticking behind the chest bones suggest a problem where? Orophase, pharyngeal phase, or esophageal phase? Yes, exactly. You've heard me right because you were paying attention to my lecture. It is the esophageal phase. One more question to trick you. The upward lift of the voice box helps with chewing, airway protection, or saliva mixing. It's obvious, right? Airway protection. Correct. Okay, so swallowing is a gateway to nutrition. When swallowing becomes difficult, life changes, but support is available. To you who are watching this, if you are a patient, you're not alone, you're safe. Swallowing is possible with the right guidance. And if you are a dietitian watching this, you play a very essential role. You observe your diet adjustments and your coordination with the language and speech pathologist can prevent aspiration, protect nutrition, and it can transform hundreds of lives. So let's continue to work together to make swallowing safe, dignified, and comfortable for everyone. Thank you so much for being here.